Good day, everyone. I am Crystal Claire C. Agustin, the leader of Group 1, and today we'll be discussing our answers in nervous system and special senses in worksheet number 6.
Hello everyone, my name is TRISHA Bautista and I am discussing the neuron anatomy and physiology. So number one, the cellular unit of the nervous system is the neuron. What is the major function of this type cell? Well, this type cell is transmitting messages from one place to another. Neurons or nerve cells specialize to transmit impulses. Number two, the supporting cells or neuroglia have numerous functions. Name three. Well, the supporting cell acts as phagocytes, protect the myelinate, and act as selective barrier between the capillary blood supply and the neurons. Proceed to number three, match its statement with the response chosen from the key. So number one, we have the central nervous system, which is the brain and spinal cord collectively. A tiny gap that separates two neurons is called synaptic cleft. Number three, a collective of nerve cell bodies found outside the central nervous system is what we call ganglion. Number four, neuron connecting sensory and motor neurons are called interneuron. Number five, neuron process running through the CNS is what we call tract. Number six, collections of nerve cell bodies inside the CNS, it's called nuclei. 7. Neuron that conducts impulses away from the CNS to muscles and glands. We have efferent neuron. Number 8. Neuron that conducts impulses towards the CNS from the body periphery. It's called neuron transmitters. Lastly, number 10. We have the specialized supporting cells of the nervous system. We have neuroglia.
So number 4, draw a typical neuron in the space below. Include and label the following structures on your diagram, which consist of cell body, nucleus, dendrites, axon, axon terminals, myelin sheath, and nodes of Reinvier. For number 5, how is one-way conduction at synapses ensured? So for our answer, a synapse is formed when the axon terminals of one nerve fiber come into contact with the dendrites of neighboring neurons. The axons and dendrites functions ensure one-way conduction. These guarantee one-way conduction since neurotransmitters are released exclusively from the presynaptic and the receptors are only found on the postsynaptic end. Number 6, what anatomical characteristics determine whether a particular neuron is classified as unipolar, bipolar, or multipolar? The placement of dendrites and axons easily helps determine whether a neuron is unipolar, bipolar, or multipolar because unipolar neurons have one axon. Bipolar neurons have an axon and one dendrites extending from the cell body toward opposite poles. And multipolar neurons have multiple dendrites and a single axon. For number 7, we have described how the squam cells from the myelin sheath and the neurolemma encasing an axon. So the squam cell will initially encircle a piece of the axon inside a cytoplasmic groove. Following that, it will start rotating around the axon. Then, the myelin is wrapped in several layers surrounding the axon, resulting in a densely packed membrane. The nerve fiber's outermost layer in the peripheral nerve system is referred to as a neurolemma. For number 8, correctly identify the sensory afferent neuron, interneuron, and motor neuron in the figure below. So, which of these neuron types is or are unipolar? Our answer is sensory neurons. Then, which is or are most likely multipolar? Our answer is motor neurons.
Hello and good morning, everyone. I am Ryan Edward BAGASLAO, and I will be reporting the structure of a nerve. For number 9, what is a nerve? It is a macroscopic cord-like structure of the body comprising a collection of nerve fibers that convey impulses between a part of the central nervous system and some other body region. State the location of each of the following connective tissue coverings. For endoneurium, it is a layer of delicate connective tissue around the myelin sheath of each myelinated nerve fiber in the peripheral nervous system. It surrounds individual axons. Peroneum surrounds bundles of axons to form fascicles, and for epineurium is the outer surface of a nerve, which is the surrounding layer of fibrous connective tissue. It surrounds the nerve fascicles. Number 11. What is the value of the connective tissue wrappings found in a nerve? Its value is to provide insulation to the axons for cleaner conduction of signals. Define mixed nerve. Mixed nerve are the nerves that perform both the action of sensory nerve as well as a motor nerve. These nerves also carry afferent and afferent neurons. For the nerve impulse, number 13. Match each of the terms in column B to the upper right definition in column A. Number 1 is a reversal of the resting potential resulting from an influx sodium of ions is depolarization. Then number 2, period during which potassium ions are diffusing out of the neuron is repolarization. Action potential is the transmission of the depolarization wave along the neuronal membrane. Lastly, sodium-potassium pump is the mechanism that restores the resting membrane voltage and intracellular ionic concentrations. Number 14, would a substance that decreases membrane permeability to sodium increase or decrease the probability of generating a nerve impulse? It would likely decrease the probability of generating a nerve impulse. Number 15. Why don't the terms depolarization and action potential mean the same thing? Um, this is because the depolarization is the reversal of membrane potential due to an influx of sodium ions. It is any change in a neuron that makes it more positive than resting potential. But an action potential only occurs when depolarization reaches the threshold level.
Next is growth anatomy of the brain and cranial nerves. The human brain. Number 1. In which of the cerebral lobes, frontal, parietal, occipital, or temporal, would be the following functional areas be found? Auditory area, temporal; primary motor area, frontal; somatic sensory area, parietal; olfactory area, temporal; visual area, occipital; Broca's area, frontal. Number 2. Match the letter on the diagram of the human brain. Write lateral view to the appropriate terms listed at the left. Number 1. Frontal lobe, H. 2. Parietal lobe, P. 3. Temporal lobe, J. 4. Paracentral gyrus, F. 5. Parieto-occipital sulcus, C. 6. Postcentral gyrus, A. 7. Lateral sulcus, I. 8. Central sulcus, G. 9. Cerebellum, E. 10. Medulla oblongata, L. 11. Occipital lobe, D. 12. Pons, K. 3. Which of the following structures are not part of the brainstem? So the answer is cerebral hemisphere and cerebellum. Next is number 4. Complete the following statements by writing the proper word or phrase
in the corresponding block at the right. And gyres is an elevated ridge of the cerebral tissue. Inward folds of cerebral tissue are called sulci or tissue. Gray matter is composed of neuron cells body. White matter is composed of myelinated fibers, a bundle of fibers that provide for communication between different parts of the CNS is called an projection, whereas one that carries impulses between the periphery and CNS area is called and basal cells. Nuclei deep within the cerebral hemisphere, white matter, are collectively called the nerves.
Hello everyone, my name is Crystal Claire C. Agustin, and for number 5, identify the structures on the following sagittal view of the human brain by matching the lettered areas to the proper terms at the left. So for number 1, cerebellum, it is located at the location P. For cerebral aqueduct, it is located in the location M. Cerebral hemisphere is for the location A. Cerebral peduncle is for location L. Choroid plexus is for location H. Corpora quadrigemina is for location K. Corpus callosum is for location B. Fourth ventricle is for location N. Hypothalamus is for location D. Mammillary bodies is for location F. Intermediate mass is for location C. Medulla oblongata is in the location Q. Optic chiasma is for location E. Pineal gland is for location J. And pituitary gland is for location G. Pons for location letter O. And lastly, for the thalamus is on the location letter I. For number 6, using the anatomical terms from item number 5, we will match the appropriate structures with the following descriptions. So number 1, it is the site of regulation of body temperature and water balance. It is the most important autonomic center of the brain. Our answer is the hypothalamus gland or the pineal gland. And number 2, it is located in the midbrain, contains reflex centers for vision and hearing. It is the corpora quadrigemina. And for 3, coordinates complex muscular movements. It is the cerebellum. And 4, it contains autonomic centers regulating heart rate, respiration, and other visceral activities. It is the medulla oblongata. Number 5, large fiber tract connecting the cerebral hemispheres. It is the corpus callosum. And 6, it is part of the endocrine system. It is the pituitary. And 7, canal that connects the third and fourth ventricles. It is the cerebral. And 8, it is the intermediate mass as part of it. It is the thalamus. And now for 7, explain why trauma to the base of the brain is often much more dangerous than trauma to the frontal lobe. So our hint is that if we will think about the relative function of the cerebral hemispheres and brainstem structures in which contains centers more vital to life. So trauma to the brainstem, which is located at the base of the brain and is responsible for vital life activities such as breathing, heartbeat, and vasomotor center. It which is blood pressure. It creates malfunctions and is considerably more harmful since it causes motor function loss, paralysis, coma, and death. Now for the meninges of the brain. Number 8, identify the meningeal or associated structures described below. So number 1, it is the outermost layer, tough fibrous connective tissue. It is the dura mater. Number 2, it is the innermost vascular layer covering the brain, and it follows every convolution. It is the pia mater. Number 3, drain cerebrospinal fluid into the venous blood in the dural venous sinuses. It is the arachnoid villi.
Number 4, structure that forms the cerebrospinal fluid. It is the choroid plexus. And 5, it is the middle layer, which has delicate and with cottony fibers. It is the arachnoid matter. And 6, a dural fold that attaches the cerebrum to the crista galli of the skull. It is the falx cerebri.
For cerebrospinal fluid, number 9, fill in the flow chart to indicate the path of cerebrospinal fluid from its formation site. Assume that this is one of the lateral ventricles to where it is reabsorbed into the venous blood. So from lateral ventricle to foramen of Monro to third ventricle, cerebral aqueduct, fourth ventricle, foramen of Luschka and Magendai to subarachnoid space to arachnoid villi and then to the venous drainage of the system of the brain. For number 10, on the accompanying diagram, label correctly the structures involved with the circulation of the cerebrospinal fluid. On the right, we have the lateral ventricle, third ventricle, cerebral aqueduct, lateral apparature, and on the left, we have the median apparature.
Now for the cranial nerves, number 11. So using the following terms, correctly identify all structures indicated by leader lines on the diagram. So on this slide, we could see the diagram of the brain. So there are many parts, and the central of this diagram is the diagram of the 12 cranial nerves. So the 12 cranial nerves are the nerves that is originate in our brain. So each cranial nerves has designated function and number according to its location. So we can see the olfactory bulb, optic nerve number 2, optic chiasma, optic tract, oculomotor nerve number 3, trochlear nerve, trigeminal nerve, abducens nerve, facial nerve, and many more. So these nerves or the parts of the brain has its designated function and specific scientific Roman numerals that are used to describe and reflect their location. Now for number 12, using choice from the key provide the name and number of the cranial nerves involved in each of the following activities, sensations, or disorders. Number 1, smelling a flower. It is the olfactory or the cranial nerve number 1. It is the nerve for smell. And number 2, slowing the heart, it is the vagus, which is the cranial nerve number 10, which its function is for the muscle movement. Number 3, chewing food, it is the trigeminal or the cranial nerve number 5, for its function is for the sensation. Number 4, reading the newspaper, it is the optic or cranial nerve number 2, which is function is for the eyes or visual. Number 5, it is the feeling a toothache. It is the trigeminal cranial nerve number 5. It is because it is for the sensation. 6, tasting well-seasoned food. It is for the facial cranial nerve number 7, for it is part of a tongue which can taste well-seasoned food. 7, listening to music. It is the vestibulocochlear nerve or the cranial nerve number 8, which is function is for hearing. And 8, rotating the head. It is the accessory nerve or the cranial nerve number 11, which is responsible for muscle movement of the sternocleidomastoid and the psoas muscle. And lastly, for number 9, raising the eyelids. It is for the oculomotor, the cranial nerve number 3. This is the spinal cord and spinal nerve. Anatomy of the spinal cord number 1. Complete the following statements by inserting the proper anatomical terms in the answer block. The superior boundary of the spinal cord is at the level of the foramen magnum of the skull, and its inferior boundary is at the level of vertebra L2. The collection of the spinal nerves traveling in the vertebral canal below the terminus of the spinal cord is called the cauda equina. Number 2. Using the terms below, correctly identify on the diagram all structure provided with the leader lines. As you can see the picture below, the answer is the central canal. In the right side, the answer is white matter, dorsal or posterior horn, lateral horn, ventral root of spinal nerve, dorsal root, ganglion, dorsal ramus of spinal nerve, ventral ramus of spinal nerve. On the left side, the answer is dorsal root of spinal nerve, ventral or anterior horn, pia mater, arachnoid mater, dura mater. Next is number 3. The spinal cord is enlarged in two regions, the cervical and the lumbar regions. What is
Hello everyone, I am Nicole Adan and I will be reporting the spinal nerves and the nerve plexus. For number 4, in the human, there are 31 pairs of spinal nerves named according to the region of the vertebral column where they originate. The spinal nerves are named below. Cervical nerves is composed of C1, C2, C3, C4, C5, C6, C7, and C8. The lumbar nerves is composed of the L1, L2, L3, L4, and L5. And the sacral nerves is composed of the L4, the L5, the S1, the S2, the S3, and the S4. For the thoracic nerves, it is composed of the T1 to T12. For number 5, the ventral rami of the spinal nerves C1 through T1 is formed by the cervical plexus, while the T12 to S4 formed no plexus, which serves the cervical, thoracic, and the sacral nerves of the body. The ventral rami of T2 to T12 run between the ribs and serve the muscle between the ribs and the skin and muscles of the anterior and lateral trunk. The dorsal rami of the spinal nerve serves most of the deep muscles of the dorsal trunk responsible for moving the vertebral column. They also innervate the connective tissue and the skin near the midline of the back. For number 6, what would happen if loss of sensory or motor function or both if the following structures were damaged or transected? If the dorsal root of the spinal nerve is damaged, it results sensation from the body area served will be lost. For number 2, the ventral root of a spinal nerve is damaged, a flaccid paralysis of the muscles is served. And for number 3, if the ventral ramus of a spinal nerve, it will result to a loss of both motor and sensory function. Then, define plexus. Plexus is the ventral rami of all other spinal nerves form complex network of nerves called plexus, which serve the motor and sensory needs of the limbs. For number 8, name the major nerves that serve the following body areas. The major nerves of the deltoid muscle is called the axillary. For number 2, it is phrenic. Number 3, sciatic. Number 4, the lateral leg and foot. The answer is sciatic, common fibular. Number 5, ulnar. Number 6, musculocutaneous. Number 7, femoral. Number 8, radial. And number 9, sciatic tibial.
For human reflex physiology, The reflex arc. Number 1. Define reflex. Reflexes are rapid, predictable, and involuntary responses to stimuli. Reflexes occur over neural pathways called reflex arcs. Number 2. Name 5 essential components of a reflex arc. First is the receptor, second is the interneuron, third is the sensory neurons, fourth is the motor neurons, and lastly the effector. For number 3, in general, what is the importance of reflex testing in a routine physical examination? It is to determine the general health of the motor portion of our nervous system.
Reflexes classified as somatic reflexes include calcaneal tendon reflex, corneal reflex, patellar reflex, and plantar reflex. The simple stretch reflexes are patellar and calcaneal tendon reflexes. The superficial cord reflexes is plantar reflex. Reflexes classified as autonomic reflexes include pupillary light reflex. For 5, name 2 cord mediated reflexes, and those are patellar and plantar reflexes. Name 1 somatic reflexes in which the higher brain centers participate, and it is pupillary light reflex. Trace the reflex arc, naming efferent and afferent nerves, receptors, effectors, and integration centers for the following reflexes. First off, patellar reflex. Hit patellar tendon to excite muscle spindles of quadriceps or afferent nerve, femoral nerve to integration centers. 12 to 14 from there, it goes to afferent nerve, femoral back to quadriceps. Effector to make contraction. Also sends to unsting or effector to give it resistance. Next is calcaneal tendon reflex. It tendon nociceptors. Calcaneal tendon reflex. It tendon nociceptors in tendo Achilles. Goes to CNS by sciatic nerve or afferent, then goes to interneurons in spinal cord, integration center S1 to S2, then to alpha motor and or efferent and tibial nerve from sciatic nerve to, to lead the effector gastrocnemius muscle. What is the effect of muscle fatigue on your ability to produce the patellar reflex? The response was lesser than usual. Next, number 8. The pupillary light reflex and the corneal reflex illustrate the purposeful nature of reflex activity. Describe the protective aspect of each. Pupillary light reflex is to protect and help control the eyes from damage from different light settings. Corneal reflex is to protect the eyes from foreign bodies and lights. 9. Was the pupillary consensual response contralateral or is ipsilateral? Answer is contralateral. Why would such a response be of significant value in this particular reflex? Answer is help even out light rays, making it less stressful for the affected eye. Number 10. Differentiate between the types of activities accomplished by somatic and autonomic reflexes. Our answer is somatic reflexes include all pathways that are voluntary actions of the body. and autonomic reflexes include all pathways that result in involuntary actions.
Into special senses, I am Trisha Bautista and I am gonna discuss the eye and vision anatomy. So, the destruction in number one, several accessory eye structures contribute to the formation of tears and or help lubricate the eyeball. Match the described accessory structures with their secretion by choosing answers from the key. The key are conjunctiva, lacrimal glands, and dorsal glands. Number one, the key for mucus is conjunctiva, oil is for dorsal glands, salt solution is what we call lacrimal glands. Moving on to number two, the eyeball is wrapped in adipose tissue within the orbit. What is the function of the adipose tissue? Our answer is to act as a cushion. Number three, why may it be necessary to blow one nose after crying? Our answer, because a tear drain into the nasal cavity. Number three, why it may be number four, what is a sty? A sty is an inflammation of the dorsal gland. Follow-up question, what is the conjunctivitis? It is an inflammation of the conjunctiva. Number five, which seven bones from the body orbit? If you can't remember, check a skull or your textbook. So we have the frontal, followed by zygomatic, palatine, ethmoid, sphenoid, lacrimal, and maxilla. Number six, we have the diagram here. Identify the lettered structure on the diagram by matching each letter with one of the terms listed below. So we have the anterior segment containing aqueous humor. We have letter B. Bipolar cells, letter F. Ciliary body, we have letter D. Ciliary zunules, suspensory ligaments, we have J, and cord, we have L. Cornea, we have A. For via centralis, we have Q. E for Gallian cells, and I for iris. K for lens, optic disc is for P, optic nerve or R, photoreceptors is letter G, letter O is for retina, N is for scleras, and next scleral venous sinus is for letter C, and lastly vitreous humor and posterior segment letter M. Notice the arrows drawn close to the left side of the iris in the diagram above. What do they indicate? The arrows represent aqueous humor production and drainage into the scilem canal. Moving on, we have match the key responses with the descriptive statements that follow. Number one, attaches the lens to the ciliary body. Our keyword is ciliary zonule. Number two, fluid filling the anterior segment of the eye. We have aqueous humor. Number three, the blind spot, which is the optic disc. And the keyword for contains muscle that controls the size of the pupil is the iris. Number five, drains the aqueous humor from the eye. We have the scleral venous sinus. Number six, layer containing rods and cones, which is the retina. And the vitreous humor is the substance occupying the posterior segment of the eyeball. Number 8, choroid forms most of the pigmenting vascular layer. Number 9, fovea centralis is a tiny bit contains only cones. Number 10, lens, which is the important light bending structure of the eye shape, can be modified. Number 11. Anterior transparent part of the fibrous layer, your window on the world, is the cornea. The white of the eye is the sclera. Lastly, number 8 for the eye and vision anatomy. The instinct eye muscles are under the control of which of the following? Circle the correct response. We have autonomic nervous system and somatic nervous system. And the answer for the instinct eye muscles are under the control is our autonomic nervous system. That's all, and thank you.
Visual tests and experiments. For number 11, during distance vision, the ciliary muscle is relaxed, the ciliary zonule is taut, the convexity of the lens is decreased, and the light refraction is decreased. During close vision, the ciliary muscle is contracted, the ciliary zonule is relaxed, lens convexity is increased, and the light refraction is increased. Explain number 12. Explain why the part of the image eating the blind spot is not seen. The blind spot is caused from the optic nerve exciting the posterior portion of each eyeball. There are no photoreceptors present, therefore vision is lost when light hits this spot, or we call the blind spot. For number 13, match the terms in column B with the descriptions in column A. For number 1, we have refraction. Number 2, accommodation. Number 3, emetopia. Emetropia. Number 4, hyperopia. Number 5, myopia. Number 6, astigmatism. Number 7, convergence.
So moving forward with the ear and hearing and balance, anatomy. Number 20, select the terms from column B that apply to the column A descriptions. Some terms are used more than once. Number 1, collectively called the auditory ossicles are the anvil or incus, hammer or malleus, and stirrup or stapes. Number 2, ear structures involved with balance are the vestibule, semicircular canals, and cochlea. Number 3, transmits sound vibrations to the ossicles is the tympanic membrane. 3 circular passages, each in different plane of space, is the semicircular canals. Transmits the vibratory motion of the stirrup to the fluid in the inner ear is the oval window. The passage between the throat and the tympanic cavity is the pharyngotympanic or auditory tube. The fluid contained with the membranous labyrinth is the endolymph. And lastly, number 8, involved in equalizing pressure in the middle ear with atmospheric pressure is the pharyngotympanic tube. Identify all indicated structures and ear ridges that are provided with leader lines or brackets in the following diagram. So as you can see in the image, these are the parts of our ear. We have here the external ear composed of pinna, and we can see the tympanic membrane, the internal ear, the semicircular canals, the vestibule, the vestibulocochlear nerve, the oval window, the cochlea, the round window, the pharyngotympanic tube, and the ossicles, which are the stapes, incus, and malleus. So another match type with number 1 contains the spiral organ of Corti is the cochlear duct. Number 2, sides of the maculae are the saccule and utricle. Number 3, hair cells of the spiral organ of Corti rest on this membrane is the basilar membrane. A gel-like membrane overlying the hair cells of the spiral organ of Corti is the tectorial membrane. Contains the crusta ampullaris is the ampulla. So function in static equilibrium are the saccule, otoliths, and vestibular nerve. Function in dynamic equilibrium are the ampulla, cupula, semicircular ducts, and vestibular nerve. So it carries auditory information to the brain is the cochlear nerves. The gelatinous cap overlying hair cells of the crista ampullaris is the cupula, and grains of calcium carbonate in the maculae is the otoliths. Describe how sounds of different frequency pitch are differentiated in the cochlea. The frequency is differentiated by the strength and tension of the basilar membrane fibers. High-pitched sound makes it close to oval window, while low-pitch further up basilar membrane near the apex of the cochlea. Explain the role of the indolent of the semicircular canals in activating the receptors during angular motion. Endolin pushes copula in direction opposite to that of angular motion. This movement depolarizes hair cells, resulting in impulse transmission of vestibular division of cranial nerve number 8 to the brain. And number 25, explain the role of the otoliths in perception of static equilibrium, the head position. When the head moves, otoliths move in response to variation in gravitational pull. As they deflect different hair cells, they hyperpolarize or depolarize hair cells and modify the rate of impulse transmission along vestibular nerve.
For chemical senses, number 33, describe the cellular makeup and the location of the olfactory epithelium. The olfactory epithelium is a thin, cellular tissue that runs along the roof of the nasal cavity. In adults, it is situated about 7 centimeters behind the nostrils. It is part of the nasal septum and the superior turbinate bones. Number 34. Name 3 sites where receptors for taste are found and circle the predominant site. We have soft palate, epiglottis, and pharynx. Number 35. 35. Describe the cellular makeup and arrangement of a taste bud. Use a diagram if helpful. Number 35. Cellular makeup of a taste bud consists of 3 major types of specialized epithelial cells. Those are gustatory cells, basal cells or basal, and supporting cells. Arrangements are number 1, V-shaped row on border between anterior and posterior part of tongue. Valate PAP. Number 2, unfolds on sides of tongue. Number 3, scattered irregularly over entire surface of tongue.
For the last part of special senses, taste and smell experiments. Number 36. Taste and smell receptors are both classified as chemoreceptors because they respond to chemicals in solution. Why is it possible to taste substances if the tongue is dry? Because the taste buds dissolves in saliva, enter the taste pores. These cause mechanisms to make the taste cells to depolarize. This helps to start the way we process taste without saliva. At the beginning steps of the taste will not be activated. For number 38, name 3 factors that influence our appreciation of food. Substantive choice with an example from the laboratory experiments. Number 1, sense of smell. Substantiation The types of aromas can be smelled from afar and tempt us even before we see the food itself or taste it. Number 2. Temperature. Almost everyone considers a cold, greasy hamburger unfit to eat. Hot foods, such as chili peppers, actually excite pain receptors in the mouth. Number 3. Texture of the food. Some people will not eat foods that have pasty texture. Expand your explanation and choices by explaining why a cold, greasy hamburger is unappetizing to most people when hot. A hamburger is juicy and has enticing aroma. When cold, fat congeals, giving the hamburger a greasy taste and texture. Number 39. How palatable is food when you have a cold? The taste itself is rarely affected by a cold. Explanation: without the ability to smell what you're tasting, it's difficult to fully experience flavor. Fortunately, it only takes about a week for a cold to go away, so you won't have to wait long to enjoy all your favorite flavors again.
For the deep dive in our worksheet number 6, we will produce a performance task or performance video presenting the demonstrations on cranial nerve assessment. So we refer to the table 30 to 11 of the course here and Herb's Fundamentals of Nursing Concepts, Process, and Practice and 10th editions. So for the guidance on how to perform this procedure. So it is basically shown how the demonstration of the 12 cranial nerves assessment or examination.
Good day, I am Crystal Claire C. Agustin, and today I am your nurse student. So for today, we'll be demonstrating the 12 cranial nerves examination. So the cranial nerves are a set of 12 nerves that originate in our brain. So its function is sensory, motor, or both. So sensory nerves helps the person to smell, hear, and see, while the motor nerves helps the person to move their muscles in their neck and in their head. So, each cranial nerve reflects its function and number according to its location in the brain. So, scientists use Roman numerals from 1 to 12 to label the cranial nerves in the brain. Now, the first examination that we're about to assess is the cranial nerve number 1, which is the olfactory nerve, and its function is for smell. So, ma'am, before we start our assessment, may you plug your right nostril and try to breathe in and breathe out. Good. Now, on the other part, try to plug in also and repeat the process. Good. So I can conclude that there is a clear patency in the air passageway of your nostril. So without further ado, so may I instruct you, ma'am, to close your eyes and repeat the process earlier, which to plug your right and left portion of your nostril and identify the odor that you are about to smell, if possible. Now on the other part.
Both of my nostrils smelled menthol.
Yes, ma'am, that is correct. The odor that you smell is a menthol. So I can conclude that both of your nostril or the olfactory nerve is properly functioning.
Thank you, ma'am.
Now, let's move on to the second examination, which is the cranial nerve number 2, which is the optic nerve. And its function is for visual or a person to see. So, ma'am, without further ado, let's try your eyesight with the help of the Snell chart. So, ma'am, I'd like to request you to cover your left eye. And identify the letters in the upper portion.
E, F, P, T, O, Z.
Correct. Now, let's go to your other eye and cover it with your hand. Now, identify the middle portion of letters.
L, P, E, D, P, E, C, F, D.
Correct. Now, we'll move on to a farther distance. Now, cover your left eye again. And identify the letters below or on the lower portion.
B, E, Z, O, L, C, F, E, D.
Correct. Now, let's repeat the process on the other part of your eye. So, may you identify the left portion of the chart.
E, F, E, L, P, F.
Correct. Now, I conclude, ma'am, that both of your optic nerves in the left and right are properly functioning.
That's great.
Now, for the third examination to be assessed, we'll be assessing the three cranial nerves, which is the oculomotor or the cranial nerve number 3, trochlear, the cranial nerve number 4, and the abducen nerve, which is the cranial nerve number 6. So, three cranial nerves are both has function of the extraocular eye movement or motor eye movement. So, ma'am, may I instruct you to fixate your gaze on my finger and follow only with your eyes and not with your head. So, I will be first moving my hand an inch away to your right. Now, on the upper part, on the middle part, now on the lower part. Great! Ma'am, I conclude that the three cranial nerves that were mentioned earlier are properly functioning by the shown on the test that we have been demonstrated. Now, our fourth examination to be assessed is our cranial nerve number 5, which is the trigeminal nerve, which is the function is sensation of touch. Now, there are two sensations we are about to assess, which is the soft sensation and the other one is the prick-like sensation. So, ma'am, may I request you to close your eyes and feel the sensation that you're about to feel. Do you feel the soft sensation?
Yes.
On this part.
Yes.
And on this part.
Yes.
And lastly, on this part.
Absolutely yes.
Good. Now, I conclude that your trigeminal nerve for soft sensation is intact. Now, again, may you close your eyes for the other sensation to be felt. Now, do you feel the prick-like sensation?
Yes.
Now, on this part.
Yes.
Now, another part.
Yes.
And lastly, on this part.
Of course, yes.
So good. So I conclude that your trigeminal nerve are properly functioning for both sensation, which is the soft and the prick-like sensation.
Wow, awesome.
And now for our next examination to be assessed is the 7th cranial nerve, which is the facial nerve. So its function is for the producement of facial expressions. So ma'am, may I request to raise your eyebrows upward. Good. Now may you close your eyes deeply. Very good. I can see the intact of your facial nerve in the eye. Now next is may you smile with showing your teeth. Okay, good. I can see the symmetry of both sides of your mouth. And now lastly, can you puff out both of your cheeks? Great! I can see the full intact of your facial nerve. Now, it is properly functioning all over your face. So, that is a good result in our examination for facial nerve.
Thank you po.
Now, for our next examination is our 8th cranial nerve, which is the tribocochlear nerve, which is its function is for hearing. So, ma'am, may I request to plug in your right ear, and I will be rubbing my hands and see if you could hear it in a nearer distance.
I can hear it.
Okay, now I'll be furthered away my hands on a decent distance on your ear and tell me if you can hear it.
Can't hear it anymore.
Good. That is a good sign, ma'am, that your left ear can hear nearer and a decent distance of a sound. Now let's repeat the process on your other ear. Now plug in the other ear, and I will be rubbing my hands again in a nearer distance and tell me if you can hear it.
Yes, I can hear it.
Now I'll be moving a decent distance away from your ear and tell me if you can hear it.
I can't hear it anymore.
Okay, ma'am, that is a good sign. Both of your ear, and that is a conclusion that your tribocochlear nerve are properly functioning because both of your ear can hear nearer and a farther a decent distance of a sound.
Great, thank you po.
Now for our next examination to be assessed is the two cranial nerves, which is the cranial nerve number 9, which is the glossopharyngeal nerve, and the cranial nerve number 10, which is the vagus nerve, which both functions are for motor and sensory, and it is for swallowing and speech. So ma'am, may I request you to open your mouth and produce an A sound. Open your mouth and produce an A sound.
Ah.
Okay, very good. So ma'am, I conclude that in our examination that been demonstrated, there were no hoarseness that was being detected, and also there is no flopping inside your mouth. Therefore, your glossopharyngeal and vagus nerve are exemplary functioning. And that is now for the next examination we're about to assess is the accessory nerve or the cranial nerve number 11. So there are two muscles that is comprised with the accessory nerve, which is the sternocleidomastoid and the trapezius muscle. So ma'am, may I request you to look on your right part of your corner, and also as I palpitate your neck and this part, may you resist the movement of my hand. Now as I start, good. So they're shown that there's a greater resistance of the sternocleidomastoid of your left part. Now on the other part, let's redo the same process earlier. So as I palpitate, now you may resist it. Good. Your accessory nerve in your sternocleidomastoid muscle is properly functioning because it resists my movement oppositely. Now for the trapezius muscle to be assessed, may you lift your shoulders upward, and you will be resisting my hands as I put my hands downwardly. So let's start. Good. So your trapezius muscle or the accessory nerve or of your trapezius muscles is properly functioning as it shows great resistance, or there is no sign of weakness as I pull your shoulder downward. So the accessory nerve, both of your sternocleidomastoid and your trapezius muscles are exemplary functioning.
Wow, that's great.
Now for our last assessment to be examined is our cranial nerve number 12, which is the hypoglossal nerve, which is functions is for the muscles of the tongue. So ma'am, may I request you to open your mouth. Now may you put your tongue on the left side of your mouth. Now on the other part, now may you twirl your tongue around your mouth. And now lastly, may you curl your tongue inside your mouth. Great! Ma'am, I can see that the hypoglossal nerve of your mouth or which is the tongue, muscles of the tongue are properly functioning as you demonstrate all of my directions of your tongue. So it is a great sign that it is properly working your hypoglossal nerve.
I'm overwhelmed. Thank you, ma'am.